Final few moments here on In Focus. Need to talk solutions and involvement. What can we do? So, and Dick, how do people get involved or become cognizant or even interested in what's happening with overdoses, especially if it doesn't necessarily have a personal connection to the problem?
I'd say support your local officials like the commissioner here, Commissioner Peters, and when she brings the community together, be a community partner in this, because it is a crisis that affects everybody. It affects a lot of young children too. And also at the local level, I give a shout out to Sheriff Lehman, Seminole County. He's in a great project. He brought in about $750,000 from Walmart. He combined that with Advent Health Hospital, and he's converted to one of his facilities to a drug treatment program. He doesn't want to keep rearresting these people. There's no crime being committed. It's an opioid crisis. So there's different models around the state. Look at those models and try to engage with your local community, whether it be business community, faith community, and support your local officials and the state officials as they try to address this issue.
Like the commissioner. So, Commissioner, what can be done then on county levels to create awareness or get resources allocated? And does it really come down to community involvement and just an appetite to allocate those funds?
Well, it's going to take everything. It's going to take everyone and everything. And in our county, we're working really hard. We put mental health counselors in our sheriff's deputies' cars, and we are working with hospitals. We're partnering with that. We're creating a central receiving model. It's going to take us a little over a year to get that up and running. But it's also going to take law enforcement. Now, you got to remember, when we saw our spike in deaths, we had taken law enforcement off the street, and they were taking calls for people that were violating COVID rules. And so they weren't on the street stopping the drugs from being on the street. And so therefore, there was so much availability on the street. So Big Pharma got many, many people addicted. And then when we passed these laws restricting how much doctors can prescribe, then we forced people to go to the street to get their drugs, because we didn't deal with the addiction, right? We just cut down the source. And so people really didn't have a choice. They got addicted because they got in a car accident and hurt their back. And these are not bad people. They just got in a car accident, and then they were forced to go to the street to get their drugs because they couldn't get it from a doctor anymore. And we didn't refer them to treatment. So we have a lot of work to do. So
to bring in the Senator, we have about 10 seconds left. Someone right now who's watching who might be struggling right now, being like, am I addicted? Am I abusing? What's going on? What would you tell them?
Talk about it. National Recovery Month is coming up in September. Overdose Awareness Day is next Tuesday. Just talk about it and get some help. Overcome the stigma. There's no shame in getting help and being in recovery.
Overcoming that stigma. You got it. Panel, thank you so much for talking about this important conversation and topic. We appreciate that. And folks, thank you so much for watching. I'm Allison Walker.
More mental health services and more medications for those in need before more people die.
You know, there is just a crippling and deadly problem in Florida. According to the CDC, the state ranks second in the nation in overdose deaths. But is the overall rise in overdoses and deaths happening faster than we can get resources allocated and deployed fighting an overdose epidemic? We're talking about that right now on In Focus. And we do welcome you to In Focus. I'm Allison Walker. So in an historic settlement with four of the biggest pharmaceutical companies, $26 billion will likely be heading toward various states to address what leaders call an even worsening opioid crisis. And of that $26 billion, upwards of $1 billion could be coming right here to Florida. In Focus's Emily Braun explains why leaders fighting the crisis say this is a once-in-a-lifetime opportunity, and it couldn't come at a more important time. Watch.
For Keely Martin,
yellow star,
her daughter is her world.
You turn it. When my daughter got sick, it just opened my eyes, that we only have a short time here on earth, and, I don't want to waste it.
The 30-year-old mom spent nearly half of her life fighting not to lose control of it, and a year of it in prison.
I tried heroin at 16 and tried a needle at 16, and it just went downhill from there. I was about 17, that's when they just took over my life. Like, I didn't care what I had to do, what was going on, like that. I call it the devil's hug.
She's one of many who may stand to benefit from what leaders call a game-changing settlement. More than 3,000 cases stacked up against McKesson, Cardinal Health, AmerisourceBergen, and Johnson & Johnson could mean up to $26 billion shelled out to help states combat their opioid crises. After those suits claimed the four companies exacerbated it.
Too readily available on the side of Johnson & Johnson. It's inappropriate marketing practices.
Barbara Andraka Christou is a UCF associate professor who wrote a book about the opioid crisis. She says money could be heading to Florida within months. Some leaders say it couldn't come at a more important time. During the first 6 months of last year, there were 3,708 overdose deaths in the state of Florida.
So this money is coming at a critical point where we need more mental health services and more medications for those in need before more people die.
Although it's not certain where exactly the money would go yet, Martin says she would invest in the opportunity to help herself and others.
That one.
In the meantime, she's laser focused on recovery, dropping the label of addict, and focusing on her proudest title as mom.
Look at the shape. I might not be where I feel like I should be, but I'm definitely not where I was. So I'm happy with the way that I'm going.
Reporting in Orange County, Emily Braun, In Focus.
And some argue it was better to settle the 3,000 opioid-related lawsuits instead of taking them to trial, because while there was a chance to win more money, there was also a chance the companies involved could declare bankruptcy. So if that happened, there would be a significant decrease in the amount of money headed to states. And that money, as we are about to discuss right now, crucial in the fight against opioid overdoses and deaths. So joining me right now in this really important conversation, State Senator Darrell Roussan from District 19 in St. Petersburg. Also Pinellas County Commissioner Kathleen Peters, District 6. And Commissioner Peters is a former state representative serving between 2012 and 2018. And also Dick Batchelor, who serves on the Executive Council for Project Opioid. And Dick, also a former state representative serving between. Dick, I know Gary, our producer, wants me to emphasize the number of decades, but I want you back on the show. Just going to say in 1974 to 1982. Welcome back, all of you, to the show. You got it. And Dick, I do want to start with you, and all jokes aside, you are a part of Project Opioid, and you have just a very personal motivation to serve. So tell us about that, if you would, please.
Well, there's so many facets of this, but I'll start with Big Pharma. Big Pharma made a great contribution to this epidemic, as indicated by the lawsuits. My sister, my late sister, was getting a prescription of 120 opioid tablets per month. That's 4 a day. She was addicted. She got addicted. Big Pharma addicted her. She was buying it on the street. She passed of a heart attack, but we know that the opioid overdose was probably what really manifested her death in the end. So that's Big Pharma has to play carry a big burden, billions of dollars, but they should be out of the jail. But let me talk specifically about putting a face on it. If you look at Orange County, we've got a 63% increase in opioid deaths, not just overdoses, deaths in the last year. It's really hitting hard the Hispanic community, African-American community. It is a crisis. Andre's right. We need more funding. Hopefully the legislature will sort out that money and get it to the community so we can respond to those needs. We need to address the mental health component of this crisis, too. It's extremely important. So we need to really, again, the senator and the commissioner is a former legislator. When those monies come down, the legislature cannot divert those dollars as they do with so many programs. Those monies got to be put back in the community to really respond to this crisis. It is a crisis. People are dying every single day, particularly in our minority communities.
And these numbers that you're just mentioning, they just paint a terrible picture in Florida. And these are non-fatal. Take a look here. These are non-fatal opioid overdoses in Florida since 2015. Stats available through part of 2020. So the whole year is estimated. But gosh, I mean, we go from 7,300 in 2015, right, to over 20,000 last year, and the same sort of rise in deaths from opioids. So deaths we're talking about here in this graph, just over 2,500 in 2015 to more than 6,000 Floridians last year. And opioids, by the way, accounting for almost half of all overdose fatalities last year. So, Senator Rouson, do these numbers just scream crisis to you?
They absolutely do. And like former Representative Dick Batchelor says, the legislature must not divert these dollars away from the intended purpose, and it is to provide a solution to this addiction and save lives. We've tried to do that on the legislative level through policy and through kicking dollars out the door. The first part of the settlement against McKinsey Company came through before session was over, and the Senate President allowed me to negotiate with Representative Colleen Burton how that $11 million would be spent in its first year. And we were able to get some of that funding through DCF, and it's already been deployed for medication-assisted treatment, abstinence-based treatment, and prevention dollars are already out there.
And now, Commissioner Peters, you were, of course, in the legislature, and now you're at the local level. So tell me the local impacts that you are seeing from overdoses.
Well, thank you for the opportunity to be here. And the reason I switched to the local level is because as you know, I've talked with you before, I did sweeping reform on mental health and addiction in the legislature. But when the rubber hit the road, people weren't getting access to care when they were really in need and sick. Now, in Pinellas County in 2020, we lost 540 people to an overdose death. And I spoke to my medical examiner's office last week, and she said we're on track to potentially reach 700 people will die this year of an overdose. So it's really more than, an epidemic, absolutely, more than a crisis. It's really, really critical, and we need solutions that really are proven effective. And we have to do things differently because we went from 324 deaths in 2018 to 424 in 2019 to 540 in 2020. So what we're doing now isn't working. We have to be creative, and we have to work with hospitals, and we have to work with our first responders better to get people maybe on medically assisted treatment right away when we first come in, maybe Narcan them, to find a way that we can immediately do medically assisted treatment and catch them. Because we've had law enforcement respond to people who refused transport after they were Narcan and brought back to life, and then hours later, officers were at the same home and maybe should have Baker acted them on the second time, but they refused transport the second time. And then the third time, the officer went to the same house to Narcan and saved the life of that same person for the third time in the same day. He couldn't revive him, and he passed away. So I think we just need to do things differently and better, much more creative than we're doing right now, because we're not having an impact. And fentanyl is in everything. It's in the Xanax on the street. It's in the Adderall on the street. It's not just heroin, and people don't know that, and we really need to communicate that much, much better.
And hop in here, Senator. You were saying?
Well, one of these creative things that we're doing is called the Hospital Bridge Program, where we're placing peer specialists, those who are in recovery themselves, in emergency rooms, so that when these frequent flyers, as you might call them, or high users come into the emergency room, we can immediately talk with them and connect them with services. So hopefully they get handed off to treatment as opposed to back to the streets.
And Dick, though, you're in this fight really from the private sector side of things, right? So is this getting the attention of businesses? Are they getting on board with any public-private partnerships to help curb the opioid deaths, the addictions, the abuse?
Yes, let me respond to that, but also I want to follow up on what the Commissioner Peters said, because that's an extraordinarily important point. While we could blame Big Pharma, there are people, because the COVID began shut in, mental health crisis issues, they're turning to opioids, but also turning to other drugs too, like heroin. But keep in mind, as she pointed out, Commissioner pointed out, fentanyl. That's what is killing people. A lot of these drugs, most every death is somehow related to fentanyl. Fentanyl is 100 times more powerful than heroin. So fentanyl is a big player in the deaths of these people who are opioid overdoses, right? So to your question, yes, the Central Florida community has come together. Our Red Lobster CEO has been our chairman, brought the community together, but not only the business community, but the faith community, a very diverse community, to say we can handle this crisis together. Now, through the efforts of the Not-for-Profit Association, we're now reaching out and trying to create opioid task forces in 5 large communities by partnering with the business community throughout the state of Florida. So the business community has been responsive. And I'll tell you, the people that we deal with that really I think are very most important, and that is the human resources directors, the benefits administrators, those people at the corporations who are the first to hear about a crisis. So we're trying to reach out with Sherm. We're dealing with them directly. And you've got to reach the people at that level who are the ones that become first knowledgeable about any employee that might have a crisis situation that needs to be handled, is those HR directors.
So let's pause on this note, folks. Let's take a quick break here on In Focus. So up next, it's not just about death. From Florida, yearly non-fatal, so non-fatal overdoses of all drugs since 2015, increasing by almost 20,000 in that 6-year period, an estimated 46,000 plus last year. And then there's opioids. That same 6-year time period, the number of overdoses nearly tripling from 7,300 to over an estimated, again, 20,000 last year. So Senator Rustani, these numbers, I hate saying them out loud, especially for opioids. And are these increases just out of control in the sense that we can't get resources allocated fast enough to keep up with what's going on out there?
Well, the bad news is we don't have a choice. We must provide adequate resources to keep up with this crisis because it means life or death.
And Commissioner, then I do want to know about the impact, though, that overdoses are having on the county as a place to live. Are there perception problems? Do people have their heads just buried in the sand about this problem? What's going on over there?
Well, I think we're not talking about it enough. And in this last year, really, the focus was singly focused on COVID. And so there really hasn't been stories about how horribly devastating this has been for so many families. And with people being isolated for so long, it's just a mix that fuels people's addiction problems and their depression and their mental health issues. And so like I said, we really have to be, everything we do has to be multi-focused, right? We have to do an education campaign to let people understand how serious this is and how dangerous these drugs can be. And then we also have to have, the prevention and the intervention and hopefully get, stop the trend of addiction. I think every community needs a central receiving facility. I think every community has to have their data sets all talking to each other. I think our central receiving systems need to do warm handoffs and not cold handoffs. Just giving somebody a phone number as a referral isn't working. By giving them an appointment on a certain day and ensuring there's transportation might be more effective. And so everything we do is going to have to be multifaceted.
Dick, we're at that point where we're now collecting data, right, from the pandemic. The Commissioner mentioning that. And so what behaviors happened during this pandemic that perhaps haven't happened before or are contributing so severely to this uptick?
Well, I think the data points out that very accurately that a number of people might have had an addiction issue before the COVID epidemic or the pandemic hit us, number one. Number two, it got exacerbated. And then there were those people who probably, because of mental health challenges, might have turned to the drug. And that's why it's so important that mental health has to be talked about when you talk about drug treatment. Mental health has got to be a part of that treatment modality. You can call it a comorbidity if you want to. But let me take this chance to applaud the legislature, too. Keep in mind, they closed down the pill factories several years ago. And if you look at a lot of the burden is on the individual, of course, because they're the abuser. If you look at it, the number of opioid prescriptions are down by 70% now because of the response of the legislature to the pill factories, down by 70% prescriptions of opioids. But the death from opioids, abuse, is up 40%. So big pharma can be blamed, but the individual's got to take responsibility. So the community, ergo the community, has to come together with the business community, the faith community, the local leaders, the state leaders, and say this is a crisis. It is not just an opioid crisis, it's a fentanyl crisis, and we must respond to it as we would with any crisis.
So with committees starting, in about a month, Senator, I mean, what conversations do you expect to have this go-around that's been different from previous sessions?
Powerful conversations that lead to action. One of the things we did last session was we passed Senate Bill 96, a big child welfare bill that included in it a commission to study the mental health systems and substance abuse solutions in this state. That commission is in the process of being named right now. I expect that they'll be meeting to provide a report before session begins, and then we'll take some action. This pandemic has exposed an epidemic, some of which was going on before the pandemic, but certainly has gotten exacerbated and aggravated because of the pandemic. People are isolating. They're suffering loss issues, loss of loved ones, loss of job, loss of normalcy, and they've turned to substances as a mechanism to cope. So we're going to take a hard look at it during committee weeks and during session, and hopefully we'll take some action.
It's just a very frustrating topic. So it feels like we're taking all of our tools out, but we're not finding the ones that are just the most effective as of yet. So, folks, let's take a final break here on In Focus. Coming up, our final focus, solutions, and how you can get involved. Focus continues right after the break. Stay with us here on Spectrum Networks. Final few moments here on In Focus. Need to talk solutions and involvement. What can we do? So, and Dick, how do people get involved or become cognizant or even interested in what's happening with overdoses, especially if it doesn't necessarily have a personal connection to the problem?
I'd say support your local officials like the commissioner here, Commissioner Peters, and when she brings the community together, be a community partner in this, because it is a crisis that affects everybody. It affects a lot of young children too. And also at the local level, I give a shout out to Sheriff Lehman, Seminole County. He's in a great project. He brought in about $750,000 from Walmart. He combined that with Advent Health Hospital, and he's converted to one of his facilities to a drug treatment program. He doesn't want to keep rearresting these people. There's no crime being committed. It's an opioid crisis. So there's different models around the state. Look at those models and try to engage with your local community, whether it be business community, faith community, and support your local officials and the state officials as they try to address this issue.
Like the commissioner. So, Commissioner, what can be done
Yes.
then on county levels to create awareness or get resources allocated? And does it really come down to community involvement and just an appetite to allocate those funds?
Well, it's going to take everything. It's going to take everyone and everything. And in our county, we're working really hard. We put mental health counselors in our sheriff's deputies' cars, and we are working with hospitals. We're partnering with that. We're creating a central receiving model. It's going to take us a little over a year to get that up and running. But it's also going to take law enforcement. Now, you got to remember, when we saw our spike in deaths, we had taken law enforcement off the street, and they were taking calls for people that were violating COVID rules. And so they weren't on the street stopping the drugs from being on the street. And so therefore, there was so much availability on the street. So Big Pharma got many, many people addicted. And then when we passed these laws restricting how much doctors can prescribe, then we forced people to go to the street to get their drugs because we didn't deal with the addiction, right? We just cut down the source. And so people really didn't have a choice. They got addicted because they got in a car accident and hurt their back. And these are not bad people. They just got in a car accident, and then they were forced to go to the street to get their drugs because they couldn't get it from a doctor anymore. And we didn't refer them to treatment. So we have a lot of work to do. So to bring in the Senator, we have about 10 seconds left. Someone right now who's watching who might be struggling right now, being like, am I addicted? Am I abusing? What's going on? What would you tell them?
Talk about it. National Recovery Month is coming up in September. Overdose Awareness Day is next Tuesday. Just talk about it and get some help. Overcome the stigma. There's no shame in getting help and being in recovery.
Overcoming that stigma. You got it. Panel, thank you so much for talking about this important conversation and topic. We appreciate that. And folks, thank you so much for watching. I'm Allison Walker. Can't wait to see you next week right here, same time, same place on In Focus. Have a good one.